I'm Karen Daley, President of the American Nurses Association. For 26 years, I was a staff nurse and loved my practice. I had a rewarding career and couldn't imagine doing anything else. But one day at work in the summer of 1998, I was stuck with a needle protruding from a sharps container. I didn't know it then, but my life was changed forever that day. A few months later, I learned that the fatigue, weight loss, and other symptoms that I was experiencing were due to hepatitis C and HIV that I had contracted from that needle stick. In the beginning, I didn't know if I'd survive or what my life would be like. I had to leave bedside nursing and I wasn't sure what I would do. One thing I was sure of is that my injury was preventable, and I didn't want to see this happen to anyone else. I turned my energy to that cause and found myself in the halls of the Massachusetts legislature and later Congress as an advocate for needle stick prevention. With leadership from ANA, support from state nurses associations, and grassroots advocacy from nurses and stakeholders around the country, we succeeded in getting Congress to pass the Federal Needle Stick Safety and Prevention Act. The law, enacted 10 years ago, requires that employers provide safer devices to protect healthcare workers from sharps injuries. It also calls for frontline workers to be involved in the evaluation, selection, and implementation of safer devices, and requires that employers maintain a sharps injury log. We know that this law has made the work environment safer and protected many nurses from the devastating consequences of a needle stick. On this 10th anniversary, I want to remind all nurses of their rights under this law. You need to hold your employers accountable for following the law and refuse to accept anything less. But we have more work to do. I believe that nurses deserve a safe, healthy work environment. Nurses shouldn't need to worry that they will go to work one day and sustain a life-changing injury. ANA is leading campaigns to eliminate manual patient handling, reduce workplace violence, mandate safe staffing, and limit exposure to harmful chemicals. I believe that all of these goals are within our reach. A decade ago, I became an activist. Through that experience, I learned about the power of nurses working together and in partnership with ANA. Please join me in this important work. For more information, visit our website. Thank you.